Hello, I'm Ed Ness, President and CEO of Munson Healthcare. As we continue to operate in these uncertain times and respond to the COVID-19 pandemic, I want to thank everyone in Northern Michigan for your continued dedication to flattening the curve of COVID-19, and for all those who supported your local hospital by securing, donating sources of PPE, making homemade masks, charitable giving, or simply writing thank you cards to healthcare workers. I also want to thank our frontline staff and providers who continue to demonstrate flexibility, courage, and compassion throughout this crisis. Over the past few months, Munson Healthcare underwent rapid changes to improve the lives of our patients. Throughout the pandemic, we quickly adjusted our operations to meet the requirements of executive orders. We launched virtual visits and leveraged new technology to connect patients and families under tight visitor restrictions. Many of our healthcare team members adjusted to new ways of working from home, and we regionalized care delivery to balance and conserve valuable resources across Northern Michigan. This has not been easy, and I want to thank everyone for pulling together during these unprecedented times. In April, I explained the initial financial impact that COVID-19 would have on our healthcare system and announced some important short-term steps we were taking to address this impact. In Phase 1 of our COVID-19 recovery plan, we furloughed some employees, reduced work hours for others, put holds on capital projects, and all vice presidents and above took pay cuts. One-time government grants and loans have helped cover about 50% of the lost revenue and additional expenses we have incurred since March. Now that some restrictions have been loosened and some services are reopening, we must turn our attention to the future. As we look ahead, Munson Healthcare will need the flexibility to treat both COVID-19 and non-COVID-19 patients simultaneously until a vaccine is available, and we still don't know if a second surge will occur. This will continue to disrupt our operations and processes into the future. And much like other businesses impacted by COVID-19, Munson Healthcare does not anticipate returning to pre-COVID patient volumes in some areas of our system for the next 12 months. Although some areas have become busy, others remain at 80 to 90% of pre-COVID volume levels. Several factors are contributing to this long-term disruption. Some patients remain concerned about seeking care for fear of COVID-19. Some have unexpected financial strains on household incomes, and some have felt the impact of job loss on insurance coverage. In addition, COVID-19 precautions impact operational capacity of our schedules and waiting rooms. Supply chain shortages and the availability of PPE remain a risk into the future. In addition, we anticipate state and federal budget deficits will likely become significant in the upcoming years, and spending cuts related to healthcare appear unavoidable. The reality is that our healthcare system will not look the same even after COVID-19 has passed. Prior to this pandemic, Munson Healthcare was working to transform our healthcare system. Over the last several years, we've evolved from an independent hospitals providing care to each of our communities to a system that meets the needs of 500,000 people that live in Northern Michigan. This pandemic has forced us to quicken the pace of transforming how we deliver care to our community. As the largest healthcare system and the largest employer in Northern Michigan, we have a responsibility to ensure that we can continue to support our communities for the next 100 years. And we take that responsibility seriously. Over the next 12 to 18 months, or Phase 2 of our COVID-19 recovery plan, we will be transforming our healthcare system significantly. We will evolve the way we care for patients through the use of technology, telemedicine, and other innovative delivery models. We will focus on strategies that better position us to thrive in an environment that holds hospitals accountable for improving the health of the communities we serve. We accelerate the pace at which we work together to meet the needs of our rural communities. And finally, we will need to adjust our cost structure to reflect the reality of the impact that COVID-19, auto no-fault changes, and reduced funding from state and federal sources have had on our operations. Despite these challenges, I want to assure you that we do indeed have a positive future. We will weather the storm of this pandemic just like we've overcome significant challenges before. And our commitment to safety and clinical excellence remains unwavering and uncompromised. Even before COVID-19 hit Northern Michigan, Munson Healthcare was poised for change. I want to personally thank everyone in the community who has supported us during this crisis. And I ask for your continued support as we still face uncertain times ahead. I've seen firsthand what we can accomplish when we come together. Throughout the pandemic, you've stepped up with great generosity and kindness, and I'm forever grateful for your support. I am confident that Munson Healthcare will successfully navigate this crisis and move forward into the future with strength and sustainability. Thank you.